welcome to our 16th Vaccine Day. I think I know most of you, but for those of you who don't know me, I'm Ruth Karron, and I wanted to open today with a quote that I've been using in our class for the last few years. This was in The Economist, and it was on the occasion that the Nobel Prize in Medicine was awarded to Drew Weissman and also importantly to Catalin Carrico, who is actually our graduation commencement speaker this year for the university. And the quote is, "In an ugly world, vaccines are a beautiful gift worth honoring. Vaccines are not conspiracies or tools of control. They are molecular loving kindness." I also wanted to remind everyone that we are not alone in our understanding of the power and promise of vaccines. At the end of this month, we'll join with global partners to celebrate World Immunization Week. The theme this year is "For Every Generation, Vaccines Work." And this coming Monday, our colleagues at IVAC are planning an online panel discussion on the impact of vaccines across the life course to honor Immunization Week. So please mark your calendars for that. We have been extraordinarily lucky to have remarkable public health leaders and visionaries at every one of our Vaccine Day events. And of course, this year is no exception. And so I'd like to ask our Dean, Keisha Pollack-Porter, to introduce this year's guest, Dr. Jerome Adams.
Hi, good afternoon, everyone. Thank you. And thank you, Ruth. And thank you to everyone who is with us today, both in person and online. Arturo Casadevall is one of the world's leading experts in infectious diseases and one of our department chairs here at the School of Public Health, leading the Department of Molecular Microbiology and Immunology. He was once asked to describe vaccines at the highest possible level, and he summed them up with these words: "They are humanity's greatest invention." Every single year, routine childhood immunizations save 4 million lives. Calculations from the CDC show that for every $1 the United States spends on those immunizations, we save 11. In low and middle income countries, the return is even greater. Vaccines prevent death and disability, protect economic futures, and are the foundation for a healthier, more just world. But as we come together today on Vaccine Day, we know that the power and potential of vaccines is under threat. Canada has lost its measles elimination status, and unfortunately, the US is in danger of doing the same. Our efforts to eradicate polio are jeopardized by conflict, funding shortfalls, and vaccine skepticism. Worldwide, there are more than 14 million zero-dose children who've never received a single vaccine, a tragedy that we cannot let stand. Vaccines are one of our greatest inventions and interventions, but interventions alone are not enough. To continue addressing infectious disease through vaccines, we need strong health systems, sustainable financing, effective policies. And particularly at this moment, when the safety of vaccines is questioned by so many, we need thoughtful communications, deep engagement with communities, and leadership. None of this work is easy, but we're all here today because we believe in progress. And our school's own history shows us what is possible. D.A. Henderson, an alumnus and our former dean, led the global effort to eradicate smallpox. When he took on this task, it was considered near impossible. He had to build new strategies, mobilize resources, work across political and cultural lines, and find ways to reach the most remote and vulnerable communities. And he never gave up. And today, humanity is completely safe from smallpox, a disease that once killed one of every 3 people who contracted it. Across the Bloomberg School, we continue to advance the life-saving power of vaccines, accelerating equitable and sustainable access around the world. We have basic scientists working on vaccines that target viruses, bacteria, and parasites, and physicians and epidemiologists designing clinical trials. We have leaders in public health communications advancing vaccine hesitancy, and policy experts advising governments and multilateral organizations on immunization plans. We are always pushing forward, and today is an opportunity to discuss how we can advance both science and policy in the current climate. We are incredibly fortunate to be joined today by Dr. Jerome Adams, an anesthesiologist and former Indiana State Health Commissioner and the 20th Surgeon General of the United States. Dr. Adams served as Surgeon General from 2017 to 2021, a time in which the United States faced 3 back-to-back Category 5 hurricanes and a once-in-the-century pandemic. He has been on the front lines of our greatest public health challenges, working tirelessly to advance evidence-based solutions and to reach our nation's most vulnerable communities. Dr. Adams is currently at Purdue University, serving as a distinguished professor of the practice and executive director of the Center for Community Health Enhancement. In these roles, he's advocating for public policies that promote mental health and well-being and address substance misuse. He's also a regular communicator on TV, radio, and in print, and he's an expert at explaining science to the public and making it relevant to different audiences. In this time of great uncertainty, he is a powerful voice for public health. Today, he and Ruth will discuss the current vaccine landscape, focusing on vaccine acceptance and uptake in the United States. I am grateful for the chance to benefit from their perspectives and expertise, and I want to thank everyone who made time to be with us today to listen and to learn. I am confident that together we can continue to protect and promote our greatest intervention, bringing the life-saving power of vaccines to people everywhere. Thank you so much, and now I'll hand things back to Ruth.
That's one slide for the benefit of the people online. There we go.
All right, I am looking forward to this. I just really appreciate that introduction from your dean. A couple of things that I would say in reaction to the comments that she made. Yes, the traditional research that we have says every dollar spent on vaccine saves 11. However, I ran the math on the recent South Carolina outbreak, and the estimates that said that cost $35 million. And the actual ROI, if they had gotten those people vaccinated, is actually $100 to $500 for the cost of that outbreak when you consider the cost of doing follow-up, doing contact tracing, doing isolation of people and quarantining people, keeping them from school, because every kid that misses school is potentially a parent that has to miss work, and economic impact. And I say that because one of the things I think we need to make sure we do a better job of is not just quantitating the direct medical cost, but really looking at the cost to the entire ecosystem, the economic cost, the national security cost, so on and so forth. And so I think that's incredibly important. Completely agree with the sentiment that vaccines are our greatest medical invention in recent history. And I actually had a tweet that said just that a few days ago. And it's fascinating how truly engaged, to put it politely, the folks who are working against vaccines are, because I will put out a tweet that is pro-vaccine, and instantly it's overwhelmed by negative tweets which are pushing out misinformation. And I think that's another topic that we'll discuss today. But we need to do a better job of showing up and encouraging and empowering our people to show up, because I was a state health commissioner. We had to deal with a measles outbreak at the Super Bowl. And even 10 years ago when I was a state health commissioner, I was blown away when I would go to the State House whenever we're having discussions about vaccines. And I knew that all the doctors, all the public health people, and even 90+% of the parents were supportive of vaccines, but the State House was flooded and crowded with people who wanted to change our vaccine requirements and laws and rules. And if you're a legislator and all you're seeing when you look out the window is a mob of angry people telling you to change things, and no one is telling you to continue to support a certain pathway, then it's no wonder we're starting to see, or continuing to see, unfortunately now, many of these regulations and laws and rules being pulled back. So I just wanted to preface our chat with those thoughts, because enthusiasm, misinformation, framing the argument, these are all things that I think we need to talk about. I loved the past speakers you had up there. Dr. Fogarty, unfortunately, recently passed. Ann Schuckett is a dear friend of mine, and I worked closely with her throughout my career. But for me, I think the title of our talk today is how do we continue to encourage vaccines in challenging times? And so with that, would love to start the conversation.
Thank you. Yes, I think, first of all, I would just like to say we're so thrilled that you're here. You've touched on a lot of topics that I think we're going to explore a little more.
Just wanted to wet everyone's whistle a little bit.
Yes, exactly. And we'll give everyone in the audience a chance to participate too. But we have a lot of students here, and you have kind of an unusual career pathway. And I'm wondering if you could talk about that a little. You trained as an anesthesiologist, and then, became, state health commissioner, and then Surgeon General. What was that path like from individual patient care to public health, and how did you come to that?
How many students do we have in the room? Love that, love that. So students always come up to me and ask me, how do I become Surgeon General? And one of the things that I say back is that when I was in your shoes, I never could have imagined my life would take the trajectory that it has. And if you talk to anyone here at Hopkins, most of them will, if not all of them, will tell you the exact same thing. So first of all, I would say that your goal should not be to try to replicate anyone's path. What I tell earlier career younger people to really focus in on is what mattered to you when you were making a particular decision, when you were at a decision point. So that when you reach that point, you can say, oh, well, he chose this because of X, or he chose this because of Y. So true story, I got accepted to Hopkins and to Harvard. They didn't give me enough money to go to school because I grew up poor and knew I was going to have to pay for it myself. And so I went to Indiana University. I went to UMBC for undergrad and Indiana University for medical school. Yep. and hey, it worked out pretty good for me. But that said, for me, finances mattered in every decision I made. My kids, they don't have that problem. I mean, they truly, my kids, it's not even remotely on their radar in terms of thinking about how much college is going to cost when they're picking it. And that's not their fault, that's okay. But again, you wanted to really talk to enough people that you can say, okay, he or she or they picked a particular pathway for a particular reason, and that reason resonates with me or it doesn't resonate with me. Another decision point, my wife wanted to stay at home with our kids, and that was something that we agreed upon. And so we made certain decisions career-wise that allowed us to do that. And so I'll very quickly go through my pathway. I grew up in southern Maryland in St. Mary's County, and I never dreamed that I would go to medical school, much less be United States Surgeon General. And it wasn't because I didn't have the aptitude. I was salutatorian in my class. took STEM and AP classes, but it was because in that rural community, very few people, there were few doctors, and very few people went on to advanced degrees. It was actually a big deal just to go to college coming out of St. Mary's County. And so, again, I applied to several schools, got accepted to some great schools, but UMBC offered me a full scholarship to come here and be an engineer. And so I went to school to major in engineering. And I did summer internships, and this is another bit of advice I would give to younger people. And I promise I'll be quicker but with answers to the other questions. But for the students in the room, I really want you to understand, the back and forth of how I ended up where I am. And so one of the things I say to younger people also is travel as much as you can. One of my favorite quotes is by Mark Twain. He said, "Travel is fatal to prejudice, bigotry, and narrow-mindedness." Mm-hmm. And that was a blessing I had in my career. I don't think it was intentional. We grew up poor. I didn't get to go anywhere, so I had a desire to travel to new places. But in your summer internships, summer opportunities, I got the opportunity at UMBC to study in Zimbabwe and do public health work in Zimbabwe. I got the opportunity to do a summer in Holland. I got the summer opportunity to do research with a Nobel Prize winner in Colorado. And in each of those places, I learned different things. But in one of those opportunities, I was working with an MD, PhD. And I was actually working in his lab on the PhD side, but I got to shadow him while he was doing rounds in the hospital. And that was the first time I said, I kind of like this clinical care, patient care side of things. I liked the research, but I'm more of an outgoing, public-facing person. And then I had the opportunity at UMBC to come over here to Hopkins and hear a talk being given by Dr. Bain Carson. And I said, I guess there are doctors that look like me. And so that pushed me to pursue a career in medicine. I took my MCATs, again, got into Harvard, got into WashU, got into Yale, got into Indiana University. Indiana University gave me a full scholarship plus a stipend. So I went there, and Harvard called me up and said, "Are you crazy? Why aren't you coming here?" A true story. But again, it also shows you, again, the lack of awareness of a lot of our institutions in regards to the barriers that many of us face. And so I went there, and I actually thought I was going to do primary care, like almost everyone who comes into medical school. And I actually love primary care. But for me, I found that in order to do what I wanted to do in primary care, I was going to be burned out, and I realized that very early. I wanted to work with underserved communities. I wanted my wife to be able to stay at home, and I was going to have to be grinding it out, in many cases not getting paid, and working all day in order to make that work. So I switched into anesthesia, which is kind of like the internist of the operating room. You get to do a little bit of everything, and really enjoyed that. And I still practice anesthesia. I was in the operating room yesterday. And so actually Monday, today's Wednesday, sorry. But I was in the operating room Monday. I still practice one day a week. And I realized that I was enjoying what I was doing when I was in the hospital, but I was seeing the same patients over and over and over again. It clicked that I wasn't dealing with their root issues. And so that really pushed me to pursue more of a public health pathway. Got my MPH at Berkeley and continued practicing anesthesia. And Mike Pence, who was then Representative Mike Pence, became Governor Mike Pence. And when he became Governor Mike Pence, I had worked my way up through the leadership of the Indiana State Medical Association, and was a known commodity to him. And I interviewed to be Health Commissioner of Indiana, and got the job. And we had, on day 2, I had to give a press conference telling the state what we were going to do to respond to Ebola. And then we had Zika, and then we had the largest HIV outbreak related to injection drug use in the history of the United States. And that brought unique attention to Indiana. Time magazine came in and interviewed me, NPR, all the biggies. And we handled that situation, I think, reasonably well. We got harm reduction, we got syringe services programs legalized in the state. and then throughout a lot of the South. And then Governor Pence became Vice President Pence, and my name got thrown into the hat to be Surgeon General of the United States. So I was never really affiliated with the Trump side. It was Pence who really gave me my pathway. And so that's another point I would make, and then I'll stop, is that I grew up in Maryland, which is purplish, very blue in some parts. I come from a very blue family, if you will. And no one would have dreamed that a poor black kid from a blue family in Maryland would end up working for Mike Pence. But I will tell you, Mike Pence has been one of my greatest supporters. And regardless of how you feel about him politically, I will also tell you, I truly believe in my heart he is a good person. I call it the neighbor test. We've very much been forced into these binary, all or none, Democrat or Republican, good or bad ways of framing things. But there are Republicans and there are Democrats who I would not want to be my neighbor. And there are Republicans and there are Democrats who I would very much want to be my neighbor. And for my family and me, that's what's most important to me. And so Mike Pence has been very good to me. And I say that to people in the room because I see a very diverse group in here. And you may not always have the luxury of having someone who looks like you, who talks like you, who comes from your background, being available to you as a mentor or a sponsor. So you don't want to shut down opportunities. And beyond that, you want to be very open to the possibility that anyone can be a mentor or a sponsor for you. So that was a very long-winded answer to your first question, but I wanted you all, like I said, to get a little bit more context.
Yeah, thank you. Wow. So you've sort of talked about how you went from being state commissioner to Surgeon General. So you've really had a front row seat to, what people think of public health in general and what people think of vaccines in particular. And I'm really curious from where you are and also now being back in what is a pretty red state, what is your perspective on the state of vaccine confidence and vaccine hesitancy? What do you think?
Well, there was a Politico article that came out just yesterday that said that we now have a plurality of Americans who feel that our current vaccine schedule is too onerous. And that is a big change from the Kaiser study that came out just a few months ago saying that the vast majority of Democrats and even the vast majority of Republican parents support childhood vaccinations and vaccine mandates. Important to understand, there are two different polls who asked questions in very different ways, so it's apples and oranges we're talking about. The good news, to answer your question, is that I still believe most parents support childhood vaccines and school-based mandates. I believe the data still supports that. But we also have seen this creep of doubt, which is what, quite frankly, a lot of the naysayers out there wanted to happen. And one of the main purveyors of that doubt is in the most powerful health position on the planet. And I'm not saying this, again, in a pejorative way. I'm saying it in a very factual way. And so we're seeing that creep into the American consciousness. And it worries me because I absolutely understand why people across the country have bought into the idea of MAHA, better nutrition, less artificial. Anyone who's traveled internationally, has asked themselves the same question. Why do the people in France and Spain smoke way more than we do, but yet they outlive us? Why is the Coke and the bread and the French fries even healthier, made from different ingredients there than in our own country? So I agree with the nutrition, the physical activity, the chronic disease goals of MAHA. But that said, dying of a chronic disease, I hate to put it this bluntly, it's a little crass, but it's a luxury. And it's a luxury that's been afforded to us because we aren't dying of smallpox and polio. And so there is literally no way we can make America or the planet healthier if we go backwards on vaccines. And so trying to figure out how we blend those two. Again, a recurring theme that you'll hear me talk about is how we try to frame everything in very binary, all or none ways. And right now, it's been framed as you either support vaccines or you support our push against chronic disease and obesity. And we need to reject that premise. And I think that's a challenge to you all in the audience, is you've got to be more than advocates for vaccines. You have to be advocates for overall health and help people understand, yes, we can do both. We can be against obesity, and we can be pro cleaner food, and we can be in favor of better physical activity, and we can be in favor of vaccines. So I think we're at a tenuous moment to wrap up that question, a very tenuous moment, because we're seeing more and more doubt creep in. But I also think we have a good foundation of confidence and support amongst parents. And I said I was done, but the final point that I would bring up, and I think is important for you all to understand, and we were talking about this at dinner last night, is the challenge that we have is that I actually don't believe, again, bless you, apologies if this offends people, but I just don't know, and this is the cynicism in me, the cynic in me, I don't know that we ever really embraced vaccines for the good of our neighbors. I think the reason we embraced vaccines is because our grandparents saw people in iron lungs and crippled from polio and dying from smallpox. And the problem is, all the people who saw those things are now 70, 80 years old, and the parents who benefited from being vaccinated now have never seen it. And so that worries me too. And it worries me from the standpoint that I really do feel like nothing short of a lot of kids getting hurt is ultimately going to change a lot of people's minds, because they just don't believe these bad things are going to happen to them or to their kids because they haven't seen it. They haven't seen little Johnny down the street, again, being crippled from polio.
Yeah. So, you talked, when you started, you were talking a little bit about all those angry people in the State House, right? And I would say that the people who are vehemently anti-vax are very effective speakers and have a voice.
And very engaged.
And very engaged. And I agree with you that the majority of parents still want to immunize their children. We may be seeing some creep, but I think that is true. So how is it that we amplify those voices? How do we organize and amplify those voices?
Well, to the point I made earlier about us needing to be able to speak to other metrics, you just aren't going to scare a lot of these people with your kid's going to die from measles, or your kid is going to die from any vaccine preventable disease. I think we need to design our studies and frame our arguments and educate our leaders to be able to speak to metrics that people care about. So missed school, I think, is going to matter to someone. I don't think most parents understand the amount of quarantine and or isolation you need to go under if you have contracted or been exposed to measles. I think that is something that matters more to parents than your kid's going to die if they get measles. The economic cost, I'm glad to see people are doing more of that, but every study we do looking at efficacy needs to include an economic cost and say, this is how much money we are saving your state government, your county government, your local community, and then compare and saying, this is where, looking at the South Carolina outbreak, what could we do with $35 million that we spent on this outbreak? These are the potholes we're not filling. These are the police officers we're not paying to protect your community. The two top issues that people vote on in almost every election are the economy and safety and security. And it's why every person running for office says, I'm going to bring back jobs to our community, and I'm going to keep you safe. They don't say, I'm going to keep vaccinations available for you. They don't. And so we have to understand that and talk in a way that resonates with our target audience. We also have to value communication, and I say this as I'm looking at my dean at your dean, because I say this to folks all the time when I visit schools. We do not value communications in terms of promotion and tenure, in terms of giving people paid time off, in terms of rewarding people. The folks who do that don't get the same kudos, if you will, as the people who are doing the virology research, or the people who are doing the hardcore statistical analyses. I think that's a problem. I think we're getting exactly what we're paying for and what we're reinforcing and supporting, and we need to support communications training. We need to support people who do work in the policy space. I told this story last night. It's a funny story, but it's a true story. I had been health commissioner of Indiana for 4 years. I'd been Surgeon General for 2 years, and one of my mentors called me from Indiana University. True story. He's a longtime mentor of mine. And he says to me, Jerome, I think we've got it figured out. He said, if you can just get 1 or 2 more papers published while you're Surgeon General, we can get you promoted to full professor when you come back home. This is a true story. And it was reflective of a system that does not care that I was a leading health advocate on a state and national level. They cared more about me publishing a paper in Nature that none of my target audience is going to read. And so I think what we need to do is, like I said, make sure we're speaking to those folks. And we also need to make sure we're bringing in teachers. We need to make sure we're bringing in businesses to talk about the economic impacts. The opioid epidemic. It was interesting when we brought in police officers to talk about the opioid epidemic, and it hit differently than bringing in doctor after doctor and public health expert after public health expert to talk about overdoses. But you bring in a police officer, and all of a sudden people think differently. So thinking about how we widen our aperture in terms of who can be our surrogates, our advocates, the people who were at the table, that's how we win this argument instead of speaking to ourselves.
Yeah, agree. So we've talked about this a little bit too, but there was a time when vaccine science was not part of politics. It wasn't part of partisan politics. So when do you think the transition happened, and how do we find our way back?
Well, I mean, again, you can look at the trajectory, and one of the things that I tell folks is, I can make the argument that it was COVID, and I can make the argument that it wasn't COVID. The argument that it wasn't COVID is that in 2019, the last trip I took before we stopped all travel was supposed to be to American Samoa when they had the measles outbreak that killed 83 children, and when we almost lost our measles eradication status that year. So this had been a slow burn that was increasing and truly hitting a peak, a horrific peak, in 2019, but then COVID hit. And we could spend hours talking about COVID. Many of you all know I wrote a book called Crisis and Chaos, if you're interested in learning a little bit more about my perspectives of being Surgeon General during COVID. But I'll give you one point from the book. I contend that COVID would have played out incredibly differently had it not occurred in an election year. So Obama got Ebola during an off year, and it wasn't as politicized. COVID, we spent about 4 or 5 weeks talking about COVID as a virus, and then we spent the rest of 2020 talking about it as a political issue. And everything that we talked about became a symbol of who you were going to vote for. If you wore a mask, you were voting for Biden. If you didn't wear a mask, you were voting for Trump. If you supported the vaccine, interestingly enough, in 2020, you were pro-Trump. If you didn't support the vaccine in 2020, you were pro-Democratic. And the people in the room may not like to hear this, but the highest-ranking public officials in 2020 to sow doubt in vaccines were Kamala Harris and Cuomo from New York. They both publicly said, we will not trust a vaccine that comes out under this administration. So I just say that because another disclaimer for you all, because you all don't know me. I'm not a Democrat or a Republican. I take the approach that when I'm seeing a patient, I don't want to know what their politics are, and I don't want my politics to impact them or vice versa. And quite frankly, I'm ticked off at both parties right now. I think they're both failing us, and the two-party system is failing us. But I do want to call out a lot of the bad behavior that I had a unique window into being Surgeon General under a Republican administration. And again, and I said this in my book, one of the most damaging comments to me as a black man was to hear Kamala Harris tell people, don't trust this vaccine if it comes out under the wrong political flag. And you can't just win the election and say, okay, flip the switch, everybody get vaccinated. And another interesting thought experiment, and I posed this at dinner last night, how differently would things have played out had Trump won that election versus lost that election? I think then you would have had Republicans supporting the Trump vaccine, and you would have had Democrats not getting the vaccine or being hesitant about getting the vaccine. But you asked, how did this happen? It was a slow burn with a big accelerant in 2020 wrapped around this idea that these issues are political issues and not medical issues. And so I think the lesson for you all, because in my book I tell stories, but then I try to give folks a lesson, is we have to be very cognizant of when we are being sucked into a political argument versus a medical or health argument. And we have to be very careful about the language that we're using and the way that language is being weaponized, either by intention or not, or by inference, to make a political argument. Another funny story from the book, it was June of 2020, late June, and you all will remember this. Donald Trump said he wanted to hold a 4th of July rally at Mount Rushmore. And I was asked by CNN to come on, and they literally called me and said, Dr. Adams, can you come on and share tips with folks about how to stay safe over 4th of July weekend amidst the pandemic? And I said, sure, that's my job. I'm the Surgeon General. I want to keep people safe. So I go on, and I'm sitting in the green room before we go on, and the prologue that they give, the intro is, Donald Trump wants to hold a maskless rally at Mount Rushmore. Our experts say hundreds, if not thousands, could die. Coming up next, Donald Trump, Surgeon General, to explain. and that is literally how they introduced me. And then the first question they asked me is, after that intro, is, Dr. Adams, don't you agree that this rally is dangerous, and won't you condemn Donald Trump's calling to have this rally? So they're framing it not as, Dr. Adams, please help us understand the risk, of the situation. It's, won't you condemn Donald Trump, who's running for office at the time? And here's what I said. I said, look, I want people to understand their personal risk. Because we know that if you're older, if you have comorbidities, you are at higher risk. If you live with someone who has those things, then you're at higher risk. I want you to understand your circumstances. You're going to be inside. You're going to be outside. Are people going to be wearing masks? Are they not? And then I want you to make a decision that is right for you. I got ripped to shreds by you all, by the public health community. I got ripped to shreds. Now, if I'd gone on CNN and condemned Donald Trump's rally, I would have been on Fox News the next day having to explain why I wasn't condemning the Black Lives Matter rallies that were happening at the exact same time. And the moral of that story is we all got sucked into the partisan politics of 2020, and we allowed ourselves to be used as political tools, and we have to live with that. And moving forward, now people aren't going to see me as Dr. Adams. They're not going to see you as PhD or MD. They're going to see you as being affiliated with one political party or the other, and we're not going to change that right away. But one thing we can do is to understand what happened, understand why it happened, and make sure if we're being used as a political tool, it is because that is our intention. Because I will never tell folks you shouldn't get involved in politics if you feel strongly about it. That's not my place, just like it wasn't my place to tell people they shouldn't go see the President of the United States if they chose to. But also making sure you're not being inadvertently used and that you're understanding that you're sacrificing a little bit of your credibility with a lot of your target audience if you use that public health hat as a political bludgeon.
So, Surgeon General. So you've been outspoken lately about the role of the Surgeon General and qualifications for a Surgeon
Didn't think
General.
I would have to be, but
Yes. So I'd like to hear a little more from you about what you think what the role is. What do you need to do in a moment of public health crisis? What are the things that you are most proud of? What are the things you might have done differently?
absolutely. So the Surgeon General is the nation's doctor. You were the leading spokesperson on health for the United States. And that includes picking a priority or priorities that are important to you. For me, it was the opioid epidemic because that was the crisis I was facing coming into office in substance misuse, and it fit well into my training as an anesthesiologist. For Dr. Murthy, he really leaned into mental health and youth mental health. And so each Surgeon General picks their own priorities based on their history, their background, but also what they feel is going on at the time. So that's number one. But the other part of being that nation's spokesperson is you can want to focus on a particular issue all you want, but sometimes you're hit with crises. So I had to become an expert in hurricanes, as you mentioned, because a few weeks on the job, we had 3 back-to-back-to-back Category 5 hurricanes. And we had to deploy to the U.S. Virgin Islands, to Puerto Rico, to Florida, to Georgia, as part of the Public Health Service to respond to those hurricanes. And so the crisis that's going on right now in our country is a crisis of vaccine confidence and quite literally a measles outbreak that is surpassing anything we've seen in the last 30 years. And so it's one of the reasons I'm so adamant that we don't, in this moment especially, want a Surgeon General who cannot be a strong advocate for vaccines, because the moment requires it. Otherwise, we're going to see life expectancy go backwards. We're going to see people get harmed. So that's one role. Another role is advising the president, the HHS secretary, and that's more of an informal ad hoc role, but it's one that, because of COVID, I probably spent more time at the White House than any Surgeon General in history, because we were there every day. I'm probably one of the few Surgeons Generals who've been in the Situation Room, because that's a top secret room that they usually reserve for when they're going to war, and we were in there every day. And so that was a unique part of my role, but it's, again, a part people ask me all the time. I'll answer a question that I know many of you all have. How could you work for that administration, for that man, for that individual? I know many of you all asked the question because my mother asked the question. And the easy answer to that question is I had access to the most powerful decision makers in the world on a day-to-day basis. And so you can either choose to be in the room or you can choose to be out on the street. Being in the room, it doesn't guarantee that they're going to do what I say, but it at least means they've heard my version of the story. And so, Teddy Roosevelt has a quote about the man in the arena. If you haven't had a chance to look that up. But the punchline is you've got to be on the court to impact the game. You've got to be on the court to impact the game. And so I appreciated that role very much. The third role of the Surgeon General that is the most important, and I alluded to earlier, is you're actually the operational head of the Public Health Service Commission Corps, a 6,000-person uniformed service, the only uniformed service on the planet that is devoted to protecting the health and safety of the United States and the planet. We have doctors, nurses, pharmacists, engineers, therapists, health service officers. And I was incredibly proud to serve particularly in that way because I come from a military family. My dad has 6 brothers. They're all veterans. My grandfather worked at Patuxent River Naval Air Station. My aunt worked right up here outside of D.C. at the Navy base. And so it was an honor to serve. But again, back to the current Surgeon General nominee who didn't finish her medical residency, and doesn't have an active medical license, when you were Surgeon General, you need to be able to command the respect of the people who you're in charge of leading. And you need to be able to hold them to certain standards. Every physician in the Public Health Service Commission Corps has to be medically licensed, and has to have an active medical license. I actually worked at Walter Reed as an anesthesiologist while I was Surgeon General of the United States, because to me it was important to say, I'm not going to ask you to do anything that I won't do. The current Surgeon General nominee literally can't get credentialed at any hospital in America right now as a physician, because she does not have and cannot get, apparently, an active medical license. But also, when I was Surgeon General, I put out an advisory on maternal health, where I'm, to put a finer point on it, in some ways I'm chastising my physician colleagues for the poor care that they're providing. The opioid epidemic, I'm calling on people to change their prescribing patterns. Well, I can do that credibly because I literally work in the OB suite alongside folks, and I've seen these problems. I literally prescribe fentanyl and give naloxone to people. And so I can say with credibility, we need to change our behavior. But if you've never actually practiced medicine and you can't practice medicine, how are you going to credibly talk to physicians and nurses and pharmacists about what they should be doing clinically? So those are some of the roles. You asked for biggest success and biggest, I guess, failure. You didn't say it that way. You were nice. But I would say the thing I'm most proud of is really non-COVID related. Is really COVID related. It's easy. It's Operation Warp Speed. Mm-hmm. We talk about vaccines. Operation Warp Speed was the greatest medical achievement of our lifetimes, bar none. And it's just mind-blowing to me that we're in a place where the person who helped facilitate it won't take credit for it, and where we've thrown all the most of the benefits out the window. And you know who's actually glad to pick that up is China. China is glad to pick up the slack in terms of our mRNA research. So again, when you frame it in terms of the national security arguments, people will listen, even if they don't listen to the public health and the medical arguments. So very proud of Operation Warp Speed. My naloxone advisory, I'm incredibly proud of that. So one of the challenging roles about the Surgeon General, very different than the health commissioner role. I actually had 100 times more budget and staffing when I was Indiana State Health Commissioner than when I was Surgeon General of the United States. Your main tool is the bully pulpit. And it can take a while to learn how to effectively use that bully pulpit. Fortunately for me, I'd been a health commissioner prior to that. The only other Surgeon General who'd been a health commissioner prior to being Surgeon General was Jocelyn Elders. She was Bill Clinton's Surgeon General in Arkansas. But we put out a naloxone advisory, and we saw naloxone dispensing go up by 400% after that advisory. 400% across the United States of America. That probably saved tens of thousands of lives, more lives than what I will ever save as a physician. And I say that, to the folks in the room, because I know we've got students in the room. I love being a doctor. I love my one day a week when I go in for clinical care. I do. I love it. But that said, I have had exponentially more impact through my public health policy work than what I will ever be able to have in my lifetime as a physician. And that's the power of the role, and that's the success of the role. And all of you can be surgeons generals in your sphere of influence and have that impact. Biggest failure, I would say, one of them was a communications failure, and I had to learn this on the fly. I'm a doctor. If you ask me a question, I'm a doctor and a scientist. If you ask me a question, I'm going to do my best to give you an answer to that question. And it took me a long time to realize that a lot of the people asking me the questions didn't really want to hear the answer to my question. And you have to recognize that going in. You've got to not get sucked into their traps. And you also have to then say, okay, what's my message I want to get out? One of the most distressing moments that happened to me is, during COVID, we we'd go to work all day. We'd come home about 10 o'clock at night, and then Tony Fauci and I would hop on the phone at 10 o'clock at night and talk about what we were going to talk about on the news the next day. Because we would divide and conquer, and we'd flip coins. Who's getting CNN? Who's getting Fox? Truth, And I'd then stay up for an hour or so after talking with Tony and think through, okay, what do I want to say? What are my talking points? And then I get up at 4 in the morning and start worrying about it all over again. And one of the first interviews I did, I had studied harder than I'd studied for any medical exam in my life for this 3-minute CNN interview. And I go on the news, and they immediately come in at me. And before I know it, the interview's over, and I haven't gotten any of my talking points out. I was like, well, I just studied for this test, harder than I've studied for any test in my life, and I didn't get to put out any of the knowledge that I had acquired when I was taking the test. And so I would say recognizing that you're on a different playing field. And one of the things I've learned, and it's funny now because Margaret Brennan, if you saw my last, it was just a few weeks ago when I was on Face the Nation on Sunday with Margaret Brennan, she teases me about this. One of the things I've learned is in the media, the only thing you control is the first thing you say. Because after that, you're responding to questions that they ask. And I filibustered Margaret in our interview. I literally, had my opening monologue, and I got out everything I wanted to say right in the beginning because I knew after that I was going to be at the mercy of her questions. The other failure is that I didn't recognize how much, even having been in a highly political role as health commissioner, I didn't realize how much politics was going to influence the way people viewed what I said. I didn't realize that me standing next to Donald Trump was going to cause people to interpret things that I was saying in a very different way than they would interpret other people saying the exact same thing. And so one of the famous examples from the book that I give is I had been pushing for a long time to talk about the fact that people of color were disproportionately being impacted during the pandemic. And this is easy for folks to forget because it started in Asia, and then it went to Italy, and then it went to Seattle. What do those places have in common? There ain't a lot of black and brown people in those places. So literally in early 2020, there was a belief going around that COVID wasn't going to impact black people. And the NAACP called me and said, we're already starting to hear that this is disproportionately impacting black people. Can you talk about this? And so I pushed the White House to let me talk about it. And it was Mike Pence who finally stood up for me and said, let him talk about this. So at one of the press conferences, I said, I want you to understand that people of color are being disproportionately impacted by the pandemic. They're being hospitalized, they're dying at disproportionate rates. And we understand some of the reasons are related to chronic disease and a higher chronic disease burden. And I said, but I don't want you to feel like it is your fault. I said, I want you to understand that the chronic disease burden and your risk of COVID are impacted by your social circumstances. And so I was talking about social determinants of health. I was giving myself a big old pat on the back. I was like, you are literally giving America a lesson on social determinants of health, at the White House press conference. And I said, but I also don't want you to feel helpless. There are things that you can do to help improve your outcomes. I said, exercise, don't smoke, don't drink, eat healthier. And then I finished, and this was literally, and I can say this now because it's been far enough removed, I actually gave my commentary to the head of the NAACP. I ran it by him the day before, and he said, you need to speak to them directly. You need to speak to them the way that you would speak to your own folks. And so I said, do it for your abuela, because I have an abuela in my family. I said, do it for your big mama, because that's what we call my grandmother. I said, do it for your pop, because that's what we call what my kids call my dad. And I got accused of victim blaming and pandering, and I got called some of the worst names. I got called Uncle Tom, which, for those of you who aren't black or don't have a black friend, that's worse than being called the N-word, truly. And I was being called that by my colleagues, friends, and family. It was one of the lowest moments of literally my entire time as Surgeon General. I almost quit. I truly almost quit. But I had to learn that, other people, and there are other famous figures who've literally said exactly what I've said, but they weren't standing next to Donald Trump in the White House when they said it. And so they had permission to say it in the circumstances they were in, and I literally didn't have permission to be my black self while I was standing next to Donald Trump. And that was very jarring for me, but it was something I learned. And so the lesson for you all is context matters. Situation matters. Who you're standing next to matters. There's a somewhat happy ending to that story. I was almost ready to quit, and I got a call on my phone, and I don't know why I answered it because it was from an unmarked number, and usually that's a reporter. But something in my heart said to pick up the phone, and I picked up the phone, and it was Oprah Winfrey. And Oprah Winfrey said, I know you're hurting right now, and I just wanted to call you to tell you you need to stay the course. She said, people who are hurting will lash out and hurt other people. And there are a lot of people who are hurting right now, and they're not attacking you personally. They're lashing out at the fact that they feel helpless. And she shared with me a lot of the challenges that she faced throughout her career with her show. Because remember, her show was in Chicago, and it was really catered towards stay-at-home white moms. And she got a lot of flack earlier on in her career. But she said, keep doing the right thing and stay the course because we need you there. And I got to tell you, that was the warm hug that I needed in that moment. A few hours after that, Colin Powell called me, and he gave me a different version of the prep speech, which is more aligned with a 4-star general. It wasn't a warm hug. It wasn't a warm hug. But I am a spiritual person. I am personally a person of Christian faith, and I will tell you that I believe God at that moment knew what I needed. And again, got a call from Oprah Winfrey and Colin Powell when I was ready to quit at my lowest moment, and encouraged me to stay the course.
So we could talk all afternoon, I'm sure, but we don't have quite that amount of time. However, I think we're going to take some questions from the audience, and I think Judd is going to come up and moderate, because I'm sure there are questions, and people can. We have a microphone there. I see.
So thank you all. I'm Judd Walson. I'm the chair of the Department of International Health. I think I know most of you. Thank you, Jerome. Thank you, Ruth. This was fantastic. I know we are approaching or past the scheduled time, but I would encourage, if you'd like to stay, we'll do a few questions, because we really did want to have an opportunity for others to ask. So please.
And I apologize. I as you've learned, I actually cherish these formats to have longer form conversations, because these are complex issues. They aren't yes or no answers. And giving you that context helps you better understand the nuance, and also why other people may view the same information in a different way than what you view the information. So I'll try to be more succinct for the open Q&A.
Okay. Thank you very much for your great remarks. I'm Gigi Granbaum, faculty here. I wondered if you could, and I appreciate that you said that it's a good thing to be in the room, even if you don't agree with somebody about all the things. Would you feel that way if you were offered the job of Surgeon General at this moment? And I wonder if you could comment about the rise of the medical influencer community that the current nominee hails from.
So a couple of things. I believe, as I said, I am a Christian. And for those of you who've read the Bible, no one in the Bible thought they were the right person for the job, including Jesus himself. Everyone doubted whether or not they should be the person put in the role that they were put in. And so that gave me, again, the strength to take the job, and oftentimes to stay in the job. I also come from a military family, and I believe that if good people don't step up to serve, then our country will suffer. And here's a public health spin on that. Something that actually deeply worries me is that the majority of black and brown people in this country now live in red states. And if the public health community says, I'm not going to work with those people, then you are literally walking away from the communities that you have pledged to actually support. I want you all to think about that. We can't all work in New York and California. We can't. I mean, some of us have to go to Alabama and Arkansas and Indiana and Texas and Florida and do the hard work. Now, that said, you also have to be cognizant of your own mental health. And so this is something that is important to me. If you, and we all have different tolerances for different things, but if you feel that you are being personally traumatized by a situation, then it is okay to say, I can't be part of that. But what you shouldn't do is to say, you shouldn't be part of it either. That's where the problem comes in. When people then say, well, you shouldn't do that, or you're a bad person for doing that, because guess what? That person may be the only person in the room who's representing you. If I was asked right now to serve in a major role for the administration, again, I believe in service, I would say, okay, let's talk. And tell me what you're thinking. And I need to understand, is this going to be a situation that traumatizes me? Is this going to be a situation where I'm able to operate in a manner that is appropriate for me and my guardrails that I have put up? Is this going to be a situation that's going to give me greater influence or ability to impact the things that I care about than the current situation that I'm in? Those are the questions I would ask myself. And then I'd ask my wife, for permission too. But all those went into my equation before, and they go into my equation now. And the key there is, I would encourage you all, don't shut down the conversation because of your politics or your beliefs or your feelings about the people who you may have to work with. Because I saved tens of thousands of lives with an naloxone advisory that I got to put out because I was working as Surgeon General under Donald Trump. I wouldn't have had that opportunity had I not taken the role. And I don't know that someone else who was in that role would have put out that same advisory. That's an advisory that may save my brother's life. Many of you all know I've shared the story of my brother who has substance use disorder. I wouldn't have had the opportunity to work on Operation Warp Speed, and we didn't go into detail on that, but one of the great things and untold stories about Operation Warp Speed is August. Well, so June, July, Tony Fauci and Bill Gates both said publicly, we think it still could be another year or more before we have a vaccine. That's June, July. August, we got called into the Situation Room and said, we have 3 candidates that are all highly promising right now. And Francis Collins and I both said, what does the diversity look like in the trials? And it was about 3%. And so Francis and I, again, being in the room, said the people who are most disproportionately impacted need to have trust in these vaccines. And this was a real ethical dilemma for us because we knew that if we slowed down the trials, people were going to die. We knew that if we went through too fast and people didn't take the vaccines, then people were going to die. And so Francis and I really leaned in along with Tony, and we committed every Saturday morning to meeting with the companies and going over their demographic data and giving them real-time feedback and advice about how to increase diversity in trials. And the Moderna trials finished at over 30% diversity in those trials. And so, again, being at the table matters. As far as the influencer population, it's here whether we like it or not. And so, as a Surgeon General, you will always be compared to C. Everett Koop. What was interesting about C. Everett Koop is C. Everett Koop, there was CBS, NBC, ABC, and then PBS. I don't even think Fox News was a thing Fox was a thing back then. He had 4 channels. And if he wanted to put out an announcement about anything, he just had to go on those 4 different channels, and he was reaching 70, 80% of the nation. And he was reaching it in an environment where he wasn't competing against anyone else. For me, if I want to put out an advisory on anything, I have literally hundreds of cable news channels. I've got that many more social media platforms and outlets that I have to go through. And on those outlets, I'm competing against Elon Musk, who knows nothing about vaccines, but opines on them all the time. I'm competing against Joe Rogan, who has a far bigger influence with my target population than what I do. So the answer to your question is, we're here, and I think we need to adapt. We need to reward people who know how to be successful communicators in that space. We need to train people how to be successful communicators in that space, because that's where our target audience is. Most people aren't opening up Nature magazine to say, what should I do in regards to my child's vaccines? They're going to Facebook, they're going to Twitter, they're going to Instagram, they're going to Snapchat. And so that's what I would say. And the current Surgeon General nominee reflects that. And I actually don't mind the Surgeon General nominee being a social media influencer. I mind that she didn't finish her medical training and can't practice medicine, and that she won't support vaccines. But I'd be happy if she supported vaccines and actually was competent and met the minimum requirements to serve in the role and was a social media influencer, because that's literally what you are as the Surgeon General. You are an influencer. The problem is that they're saying it is more important to be an influencer than what it is to meet these minimum requirements and have the credibility. And that's not a trade-off that I think America can afford to make.
Great. Please.
Thank you. I'm going to pivot a little bit. I'm Haley. I am an associate principal with Avalier Health. I work on vaccines policy, so really appreciate the policy perspective as always. And also former Hoosier, or I guess you're a Hoosier for life. Anyway. Yeah, we'll have to talk about that Purdue thing.
Absolutely.
So I really liked your comments on your, having your July 4th safety advice being sort of framed really politically, despite it being really focused on personal risk, individual choice. I'm interested to understand how you would characterize the, I guess, so-called new ACIP's arguments around individual choice, specifically for vaccination recommendations, and particularly how you would characterize them for people who may not live and breathe this topic and are really just looking for the best advice.
No, absolutely. And again, that goes back to our storytelling. As far as individual choice in vaccines, what's the saying? Your right to swing your fist ends at the tip of my nose. I think we need to do a better job of quantitating the tip of the nose. We need to help the public understand, okay, yes, we respect your individual choice, but that may then impact whether or not you're allowed to go to school and hurt or harm other people. And most people agree with that. The other thing is that it's a false premise that we don't actually allow people to have these conversations and have a choice. And I think we need to do a better job of helping people understand this is what the process looks like when done well. And the when done well is incredibly important, because what you're seeing right now is frustration. Behind almost every person who is strongly vaccine resistant is a story of them feeling unheard by the system. And we need to remember that. It's easy for us to fall into the camp of just saying, oh, they're crazy. No, they were hurt at some point, emotionally, mentally, financially, physically perhaps, by the system, and they did not feel unheard, and we lost that trust. And so we need to make sure we do a better job of acknowledging that hurt and explaining to folks that, okay, here's what we already do in the system to protect you, and here's what we're going to do in the system in the future to protect and empower more people. So I think it's two sides. It's number one, like I said, we need to do a better job of outreach to people out there who feel hurt. We've literally got a guy who assassinated someone on live TV being lifted up as a folk hero. That is happening because America is frustrated. America is mad. 2/3 of bankruptcies are due to medical debt. We still have 28 million people in this country who don't have access to health insurance. And what you're seeing right now isn't so much an endorsement of everything that is going on as it is people making a, quite frankly, logical conclusion that the definition of insanity is doing the same thing and expecting a different result. And what's been happening thus far ain't working for me. So we need to acknowledge that, while also, again, explaining here's the economic cost to individuals and the community. Here's the national security cost. Here are the tip of the nose costs when we allow everyone to just walk in a room and start swinging their fists wildly and claiming personal choice.
Thank you. We're going to do one more question, and we're going to try to keep this to about a 3-minute answer. So we
All right.
Hint, hint. Go ahead.
Dr. Adams, thank you so much for your presentation. My name is Cassandra McIsh-Gross. I'm with the Johns Hopkins Center for Communication Programs. And I really appreciated what you said about having to shift the message, and that a message that your child is going to die of measles may not resonate with a lot of families who have never experienced that. And this is sort of along the lines of the last question, but I wanted to ask you what your advice is for providers who are interacting with families who have really deep fear of vaccinations, who have internalized a lot of the mis and disinformation out there, and who are genuinely afraid and have those trust issues that you're speaking about. Because I think that's an issue that goes beyond, appreciating how much school their children might have to miss. And just what do you advise to providers who are speaking?
That's a
to those
wonderful
patients?
question to close on, and it allows me to sneak in another one of my favorite quotes. People need to know that you care before they care what you know. And it's one of the reasons pediatricians are the tip of the spear for us, because people believe their pediatricians care about their kids. It's also why the studies still show that even though people have lost faith in the system, they still trust their doctor, their nurse practitioner, their local pharmacist. I think that's important. I think we need to empower pharmacists more, because people go into their Walgreens or their CVS a lot more often than they go into their doctor's offices. So I think that is an underutilized opportunity. Additionally, community health workers, doulas. How do we arm more frontline people, more community-facing people to have conversations about vaccines and not put it all on the one 15-minute well child visit that they get every year? I think that and those are systemic changes that I think we need to make. But again, and the other thing I would say is patience. So here, I'll finish with another story, because I love stories. It took me 6 months to convince my older brother to get the COVID vaccine. 6 months after it came out. And he's living with my older parents. He himself has risk factors. And, I could have looked at it as a huge failure. And in the moment, I did. I'm like, I'm the friggin' Surgeon General. I was involved with the trials. And he's my brother. So literally, based on our history as brothers, I literally wanted to slap him upside the back of the head and say, what the hell are you doing? Get your damn vaccine. But that's not the approach that's going to win people over. And he lives in St. Mary's County, which is very conservative, and he was in an echo chamber of misinformation about vaccines. And so I had to say, okay, I understand your concerns. Tell me more about why you're concerned. And he would give me a bit of misinformation, and I had to take a deep breath and not laugh or ridicule or say you're an idiot. I had to say, okay, well, I understand why you feel that way based on what you heard. Tell me where you got that information from. And then I said, well, here's another source of information that I go to that says something different. And we went back and forth like that for 6 months. And then one day he called me up and he says, I went to CVS today and got my vaccine. Just wanted to let you know. And I say that because it's not going to be a light switch for most people. It's not going to be one conversation or one magic word or one magic phrase or one magic technique that you use. It's going to take patience, and we have to do a better job of creating that relationship, creating that trust, because once people believe that we care, they will start to care what we know. But back to the point I made earlier, the problem is much of society has stopped believing that we care about them, that we truly care about them. And that's why they've stopped caring about what we know, and why they will listen to people who they will readily tell you don't have the training and the expertise and the knowledge base that you have. So thank you all for your patience. I really appreciate it, especially to the students for hanging in there. Happy to continue the conversation online, on Twitter, on Facebook, or Instagram, or even I hear we've got a poster session coming up too. But thank you for being such a great interviewer, and
Thank you.
Jed, thank you for inviting me here.
Thank you. And I just want to acknowledge Ruth and her efforts in coordinating Vaccine Day for not just this year, but many years. And I'm going to hand the last word to Ruth to just close us out. So thank you all very much.
Oh, thank you, Judd. Thank you so much, Dr. Adams, for being here and telling us your stories. We really appreciate them. I just wanted to mention there is indeed a poster session in Finestone Hall. We have 35 posters this year, which is great. We have a lot of students, faculty, and staff who've worked really hard on these posters. So please come and enjoy them, and I think there might even be a few refreshments. So please join us in Finestone. Thank you.
Thank you, Ruth.
Thank you, Jeff.